We have been hearing that food is our medicine. Yes, it is exactly right. But what if I told you if our food doesn't contain adequate amount of nutrients in it? Yes, in that space, nutritional supplements came in. Today, Dr. Ashwani Garg, one of the founding members of Indian Association of Functional Medicine, is with us, and he will be explaining in detail about what is the importance of nutritional supplements, and of course he will be telling you what exactly are the nutritional supplements he used to take in his own life. So welcome, doctor. So can you please explain a little bit about the importance of nutritional supplements in these days, especially in these days, why one should take nutritional supplements in one or two sentences?
Right.
Please.
Our body needs what it needs. For example, now I'm a vegetarian. I might miss on a lot of omegas, omega-3, EPA,
Yes.
DHA, ALA. Now, vegetarian sources mostly give me ALA.
ALA.
Right? My EPA, DHA is very, very critical for my immune system and for my brain health. And we are living in a world which is technocrat, a lot of radiation which you have not even seen, 5G, 4G, etc., which is damaging our DHA. I need to supplement so that I can replace and recover and maintain my cellular health. So I need to at least take 3 gram of EPA DHA every day to maintain myself. Similarly, vitamin D.
Yeah.
We need UV light to make vitamin D and enough fat in the body, cholesterol in the body. I don't get enough sunlight. I don't get enough vitamin D. My immune system is gone for a toss. I need to take some vitamin D supplement to ensure my immune system keeps up and I can fight regular infections, whatever, or my immune system is not doing a self-attack on me. Magnesium is very, very important, for example. Now, food doesn't have enough of today simply because we're not feeding the soil. The soil quality is reducing, food quality is reducing, and we don't get enough. So, a lot of people get into this hypertension simply because magnesium is missing.
Yeah.
So if we give enough magnesium, you feel arteries will relax and hypertension will get better. So that way, supplement is simply what is missing is what is to be taken. And of course, we all can take a support from a qualified practitioner to do it the right way.
Yes, you said that you have been taking about EPA, magnesium, vitamin D. Any other supplements in your bucket list?
Yes. So B vitamins is another missing one, which is we test everybody that comes to us for their problems, and B1, B2, B3, B6, B7, B9, B12 always low.
Okay.
So sometimes you need to take a supplement for that. Okay, so fundamentally 3-4 are critical ones, and if we are serious about health, B complex, vitamin D, omega, magnesium, zinc, and if infection is high or some gut function is bad, then you can opt for some probiotics.
Probiotics, okay. So in these days, these probiotics can be considered as a buzzword. You are saying that you have been taking probiotics also, am I right?
Yes. So again, symptomatically, if there's a challenge, for example, you feel bloating. Bloating can happen if there's a fungal overload. The food is not getting digested, rather it is getting fermented and putrefied, and it makes more gas. Right? That means the good guys which is required to digest that food is missing. So symptomatically you know something is not right. Then accordingly you can take a right kind of probiotic for a right situation.
Yes. What about protein, doctor?
Protein is another critical one. We work with vegan guys, we work with the carnivore guys, and when we test their amino acid profiles, they are low.
Oh.
Which means either they're not eating enough or they're not digesting enough. Again, body needs what it needs. So sometimes we need to feed ourselves a good quality, high quality protein powder, which is easy to digest. So yes, that can be really a game changer if we do the right way.
So let me put it in this way. You used to take these kind of supplements like vitamin D, am I right? Omega-3 fatty acid, magnesium, zinc, B complex,
yes.
Sometimes probiotics.
Yes.
That means according to your symptoms, if you're having any symptoms, you will be taking pre and probiotics. And then protein. Protein is also important. Okay, can you please elaborate a little bit about the dosage that you take for our audience?
Yes. So if a regular person, office going person, probably we certainly eat the food that we have, but digestion is always a challenge because of stress of our life. So protein of 35 grams to 40 grams, a good quality, which is easy to digest, is good enough.
Yeah.
Omegas, 3 grams, 2 to 3 grams in a day.
So let me intervene. Protein of 35 to 40 grams.
Yes.
Yeah. Okay. Per day.
Per day.
Okay.
Omega 2 to 3 grams. EPA,
Omega
DHA.
means omega-3 fatty acid 2 to 3 grams. That means 2000 mg to 3000 mg.
Yes.
Yeah.
Yes.
Okay.
That is, this is enough dosing is required.
Oh, okay.
See, sometimes if underdose, it doesn't work, and we think it is not working for me. Underdosing is not a good strategy.
Yeah. So that's a good knowledge. See, if someone is actually using an supplement in underdosaging and thinking that it is actually not working for me, it's mainly due to the underdosing.
Yes. Yes. No, because you see, damage is at a higher speed.
Yeah.
And repair is at a lower speed. Then it looks like nothing is working. So you need to give optimally,
yeah,
so that it can.
So you used to take 2000 mg to 3000 mg of omega-3 fatty acid.
That's right.
Okay.
That's right.
What about magnesium dosage?
So magnesium, technically we need elemental magnesium of 400 milligrams.
Okay.
So if we take a magnesium powder which is acylated with glycinate or citrate or oxide or bisglycinate or threonate, there's different forms.
Yes.
So only 10% of that is elemental.
Yeah.
So if you take that 4 grams of magnesium powder, 400 mg of elemental magnesium will be delivered. That is what is required by the body.
Okay.
And most of us are deficit. So when the deficit is more, you have to fill in more to come up to the level.
So what about zinc?
Zinc approximately 25 to 30 milligram per day is good enough.
So then about vitamin D?
Vitamin D, they say 5,000 international units to 10,000 international units is a good dose. So on a blood work, you have to maintain at 60 to 80.
So to the audience, I hope you got some idea about what exactly is Dr. Ashwani is taking as supplements in a day. So in this regard, let me reveal what are the supplements I used to take in a day. So comparing with your daily routine work, I am a little bit more fitness enthusiast. I used to run a lot. I used to work out a lot. So I used to take a different form of supplements from what you are actually taking, but something are common. Say for example, omega-3 fatty acid, I used to take around some 1000 to 2000 milligram per day. I used to take magnesium supplements, and I used to take protein in more. Say example, around some 30 to 40 grams of protein per day. And I used to take creatine also, because I don't recommend this creatine for everybody, because considering the work I am doing every day, the exertion I am doing as a fitness enthusiast, sometimes I run for 10 kilometers, I used to participate in marathons, I used to work out in gym, so I used to take creatine also. So these are the usual supplements I used to take along with multivitamin also. So I consider myself that my metabolism is at very higher level, because I keep myself moving almost all the time in a day. So I need more nutrients than a common man who used to have a daily basal metabolic rate around some 1800 or 1900 per se. The doctor is using the supplements like protein, magnesium, omega-3 fatty acid, B vitamins, zinc, and sometimes probiotics. In my case, I go for a higher dose of protein, creatine, again omega-3 fatty acid, magnesium, and also a multivitamin. This doesn't mean that you should also take the supplements. It is according to your body type, your requirement, your daily intake of food, etc. You need to consider a healthcare professional if you are not aware about anything about the nutrition supplement. So I request you to consult a healthcare professional before taking any of these kind of supplements. Thank you.